Good morning, ladies and gentlemen. In this video, we are going to learn about sanitation systems and technologies. And here, basically, we are going to look at how human excreta and wastewater is managed, how it is collected, how it is treated and disposed of in a way that protects human health and the environment. So, like I said, we look at collection, transportation, treating, and disposing of human excreta and the wastewater that comes from the bathrooms, the kitchen, and we see how we can do it in a way that protects human health and the environment. So we also look at other things like hand washing with soap and water, so that we prevent diseases that can arise from poor hygiene. So when we have proper sanitation, then we expect to prevent diseases like diarrheal diseases, which cause a lot of deaths among children under 5 years. In fact, it is the second leading cause. Then we also prevent other diseases like cholera, typhoid, schistosomiasis, hepatitis E, and all the other foodborne diseases, waterborne diseases, and other diseases that can arise from improper sanitation. We also recognize that from proper sanitation, we can have a sustainable environment because we are able to reduce greenhouse gases that could arise from improper disposal of these excreta. Then we also have protection of water when we put in place sanitation facilities that are good, then we are able to protect water sources from being contaminated, and this will shield us from these waterborne diseases. Also, you can look at it in a way of social development where people feel dignified when they use proper sanitation facilities. We also look at uh, improved quality of life whenever people do not get sick because of these diseases that could arise from improper sanitation like cholera. Then they are able to be to have a better quality of life and be more productive, which improves their economic status. So we recognize that in our setting in in the developing world, we have sanitation challenges, but also opportunities in different settings. So, in the rural setting, we often have lack of access to sanitation facilities. Most households lack proper sanitation facilities, while in the urban settings, they have a problem of high cost of these sanitation facilities. But when you look at in both settings, they often have cultural barriers of adopting to new sanitation facilities, which could be implemented uh, by agencies or development agencies. So a development agency might be bringing a new sanitation technology, but often meet those cultural barriers of people not wanting to adjust to new technologies. So the opportunities that exist in all this is that the fact that we have new technologies being adopted. For example, in urban areas where it might be hard for you to get land to dig down or dig a pit latrine, there are technologies like raised pit latrines which can solve that. Then we also have the fact that there is an opportunity for a growing movement to promote community-led total sanitation, whereby people are triggered to realize that what they have been doing as far as sanitation is concerned has not been good, and they take that initiative to put in place better sanitation facilities or measures. So this is what we call community-led sanitation, and there is a growing movement towards that direction. So the types of sanitation facilities or systems that we have are majorly three in terms of where treatment of this excreta that has been collected is concerned. So we can have treatment taking place on site, we can have it off site, and sometimes these systems can be merged, where in which case we call it hybrid sanitation system. So when we are talking about on-site sanitation systems, we have examples like the pit latrines, septic tanks, and composting toilets. And in off-site, we are looking at those sewer systems. And then we shall also see how hybrid sanitation systems can come into play. So in this session, or in this video, we want to really focus on sanitation in humanitarian settings. Whenever there is a disaster of perhaps floods, whenever there is a civil war and people have been displaced, and as a public health official, you need to put in place sanitation facilities, because these are things that we cannot do without. So whenever people have come together, they are very many, they need to have sanitation facilities. So we need to look at how we put in place these sanitation facilities that can address the needs of sanitation in these groups of people who have been affected by those unfortunate uh, situations. So we look at these emergencies in two categories. We have the acute emergency, where the disaster has just struck or there has been displacement. In that time, within a day, 2 days, or a week, what can we design in that emergency situation or that acute emergency, so as to address that need of sanitation that is in the population that has been affected. Then after we've designed that sanitation, the sanitation facilities in those in the acute emergency phase, then we should also be thinking about what we shall put in place in the stabilized situation, because in the acute phase we are going to put in simple structures that can be used by these people, but in the stabilized situation we need something that is going to be sustainable and is culturally acceptable by these people. So in the stabilized phase, we need to inquire from these people. We need to involve them so that they can we can put in place something that can be socially and culturally acceptable by these people, and they can use it over time. So the factors that we consider in putting up these sanitation facilities are quite a lot, but for this session we are going to focus on things like social culture norms, whereby we look at the method of annual cleansing in this population of that is facing this crisis, or that has been displaced, or that has been affected by civil war. So we look at those social culture norms. We look at the resources that are available, and when we are talking about the resources that are available, we want to focus on the financial resources that can give us the direction of what we can put in place vis-a-vis the financial resources that are in place. Then the locally, the human resource that is available, which skills do they possess to construct the sanitation facilities, because you do not want to implement something that is not going to be put in place because the human resource that you have does not have the necessary skills to put it in place. Okay, so we look at such resources, and then we also look at the environmental impacts of the sanitation facilities, or the method that you are going to put in place. How environmental friendly is it? Is it going to cause pollution of the water? Is it going to cause the pollution of the soil itself? So you have to factor in all those things that are in trying to put in place these sanitation facilities. Then we also look at the time constraint. Different facilities can be designed for different phases of the emergency or in these humanitarian settings. Like I said, in the acute phase, you want to put in place those simple structures which can be constructed or which can be put in place very fast so that it meets the need of the people. And in the stabilized situation where you have time to consult with these people to gather information from them, then you can put in place better structures and those which can be sustainable. Then we look at other things like physical nature of the site where you want to put these sanitation facilities. You want to focus on soil nature, soil type, water table, or the proximity of these water bodies so that you prevent pollution whenever you put in place these uh, sanitation facilities. So, in essence, or ideally, you do not want to construct your sanitation facilities uphill or on top of a hill where the this excreta can be able to leach out through the soil to the water bodies and cause pollution. So, ideally, you want to construct these uh, sanitation facilities downhill so that this contamination of water bodies and water sources is minimized. But also, another factor that you want to look at is the demography. The population of the beneficiaries will also tell you which kind of facilities you're going to put in place because you do not want to put in place something that will be filled by the population very fast. So we need to look at all those factors before we can put in place these sanitation facilities. But the acceptable facilities in humanitarian settings generally should be able to tick all the boxes that we are going to look at, and those boxes include the fact that it should not be harmful to public health, meaning that it shouldn't attract insects, shouldn't be able to pollute the water source. Like I said, ideally it should be located downhill instead of uphill so that that leaching of excreta does not take place. Then also it should provide cover to the users. And here we are looking at the fact that there shouldn't be problems of bad odors. It should be easily accessible with a clear pathway, not having to pass through bushes where you can even be bitten by a snake to access this sanitation facility or latrine or toilet per se. Then should provide privacy whereby we focus on separation of sexes. The males should be having their own compartment while the females also have their compartment that is clearly designated. And then in the female size, of course, we should have uh, provision for disposal of those menstrual materials. But also, when we look at privacy, especially in these humanitarian settings, we want to look at other places like schools, if they are set up later in the stabilized phase, the schools, the hospitals, there should be that kind of provision whereby teachers are separated from the students, for example, in schools. And when we are looking at those health facilities in these humanitarian settings or like in refugee camps, we want to see that the health workers should not be sharing the same sanitation facility with the patients because there is that feeling of privacy that is needed amongst those groups. Then it should be safe. We are looking at the fact that it should have a strong structure, the superstructure above the pit, for example, should be safe and it should be strong. It shouldn't be dark inside, and there should be lighting, or it should be close residence so that it does not breed sexual violence. Then we also look at the fact that it should adapt to population groups, especially those with special needs, like people with disabilities and the elderly plus the children. So it shouldn't be one that can be used by a few people, but all the population groups should be taken care of. So basically, when we are talking about sanitation facilities in humanitarian settings, like we stated earlier, we have the acute phase and then the chronic phase or the stabilized phase. And in the acute phase is that time when people have just arrived, maybe from their area where they were, and they were displaced by either floods or a natural disaster or by a civil war. So in that time, during that time, a day or two or a week, they need sanitation facilities. Then in the chronic phase, after some time, maybe after 2 weeks, then with participation from the beneficiaries, we can put in place better and sustainable sanitation facilities. So in the acute phase, we are looking at methods like defecation fields, trench latrines, borehole latrines, plastic bags, things that will take care of this sanitation amongst these people in that acute phase or within that short time. Then in the chronic or stabilized phase, you can now roll out better sanitation facilities like simple pit latrines, uh, ventilated improved latrines, or the VIP latrines. Then you can have twin pit latrines whereby you use one pit at a time and then shift to another after the first pit has been filled. So this will enable you to 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 empty the pit that has been used as people use the second pit, and then after the second pit also is filled, then they can go back to the first one. So that will be of course sustainable and requires time. Then we also have ecosan systems where by urine and the feces are separated. Then we have power flush latrines, which we are going to look at, then septic tanks. So all this, as you can realize, requires time to implement. It requires you to first ask the beneficiaries what they are comfortable with. Okay, so this is only possible when you give it time, and it can only be implemented in the chronic or stabilized phase of the humanitarian or the emergency setting. So, like we said, we have defecation fields in the acute phase, and these are basically makeshift areas where individuals practice open defecation due to the lack of proper sanitation facilities. They have just arrived. They do not have you. Basically, you might not be having toilets in that place. So you want to design just open defecation fields, and these will help to take care of this sanitation, but they will not be sustainable, as we shall see their challenges. So the factors, of course, that lead to implementation of these defecation fields, or why people can opt for these defecation fields, is lack of infrastructure. Like I said, in that time, you do not have proper infrastructure in place. Okay, you have just taken these people from their original place of residence, or they have just moved away from their country. They are refugees and they have come to your country. So you have allocated them a piece of land, and there isn't infrastructure to take care of their sanitation. So that is why you might opt for these defecation fields. Then there is also, of course, displacement. That is what we have just been talking about. Limited resources to put in place better emergency sanitation facilities. Then rapid urbanization sometimes can also cause people to opt for these defecation fields. But like I said, they have challenges or environmental risks, and these include disease transmission due to the fact that if they are not well constructed, you can have contamination of water sources, especially when it rains, So ideally, these defecation fields should be constructed in a way that does not allow this rainwater to go into the defecation field. So there should be like a trench that lines or that goes around that defecation field so that the running water does not access these defecation fields, but it goes through that trench before the defecation field. But of course, sometimes the rain can be too heavy that it will hit the defecation field and takes away some water. Okay, so when this happens, there could be contamination of water sources and it might cause these waterborne diseases. But also, you can imagine if these defecation fields are constructed, are put in place near fields of crops. So there, if also rain comes, then you'll be able to contaminate these fields. And when fields are contaminated, then the food that will be taken from these fields is liable to cause these fecal oral diseases amongst the people. Then we have environmental pollution, and this can be the soil and water, but also dignity and privacy. Not many people will feel very comfortable using these open defecation fields. Okay, so that is also another risk. So to address all this, you need to put in place portable toilets very fast, whereby you can use those mobile toilets instead of these defecation fields. Then you also need to involve the community in designing better sanitation facilities. So after you've put in these defecation fields, now you need to talk to the community so that you can move away from those defecation fields to better and sustainable sanitation facilities, like I said. So you need to involve them, to engage them, to know what would be better and what they would prefer to use. Then you need to educate these communities on how to properly put in place sanitation practices. After they have used these defecation fields, at least they should be able to wash their hands with soap and water. If they cannot get soap, they can use ash to replace the soap. Then you can give hygiene kits like sanitizers, always shield them from contamination of their hands. So, apart from defecation fields, in that acute phase, we can also implement what we call trench latrines, and they are basically better than defecation fields because at least for them they contain this excreta, and due to the soil that is always dug out from that trench and put on the side of this trench, it can always be used to cover the excreta, and this is why it is better than the defecation field, where in some cases the excreta is just left in the open. Okay, but in this case it can be covered by the soil that is always alongside that trench. But even in improved models of these trench latrines, we have slabs that can be put on top of this trench, and this will prevent the likelihood of users falling into the trench. Apart from the slabs, this opening on top of this slab can also have a lid, which will limit accessibility of flies and and of course, if it limits this accessibility of flies, it protects the the population from suffering from these fecal oral diseases that can arise from these flies. So uh, trench latrines are a better model that can be implemented in the acute phase and should be thought of instead of the defecation fields. Okay. Yeah. So even in some cases, you have a superstructure on top of that trench latrine that has been put. This superstructure that can be constructed on top of this trench will improve privacy and will promote that feeling of dignity amongst the users. Yeah, so basically, those are the ones that we are able to talk about in the acute phase or during that first period of people coming into a new area after displacement or after a disaster has struck. Then, so after that time, you need to be even during that time, you need to be collecting information. You need to be engaging the people to know what they would prefer. Okay, so after you've engaged these people, then you can come up with sanitation facilities that will help you in this stabilized phase. And we have a couple of them, and one of them is the pit latrine. So the pit latrine can either be a simple one or it can be a ventilated, improved pit latrine. So basically, these prevent spread of diseases, and as you can see, they are always having a vent pipe that will take away those bad odors from or the bad smells from the pit, but also they are well ventilated to allow in fresh air, and they are in most cases having a lid to prevent flies from getting out of that pit. So all this is basically designed to prevent the spread of diseases and ensure dignity in the displaced populations. So when you are designing this pit latrine, you want to make sure that it is located far enough from the water sources so that you prevent that water pollution. But also you need to make sure that it promotes privacy. There is adequate ventilation to prevent odors, flies, and disease transmission, like we had said. The depth should also be enough to ensure that waste decomposes adequately. And of course, the pit size depends on the expected usage duration. So, and also the population that you have. Okay, so in also in design consideration, you need to look at putting in place a superstructure that is very simple and sturdy or strong, but also culturally appropriate and is above the ground for privacy and safety. So you need to make sure that this superstructure is culturally acceptable, and that is why you need to involve the community before you put it in place. It should be able to promote privacy. Uh, you can either put in place that skirting that is always protecting people from being seen from outside, or if it is possible and your agency can manage, then you can put in place these doors on each of these tenses. But like we said, even on top of that, you need to separate the sexes. The females and the males should be having different compartments. Then there should be lighting, enough lighting that prevents sexual violence, especially at night. Then even inside, it shouldn't be dark. Then it should also be able to provide it should also be able to be accessible by all the population groups. The PWD should be able to come in easily, or they should be having supports inside it so that they can be able to ease themselves easily. The children should not be, they shouldn't be fearing to use them because of maybe a big hole, and they should be able to have those feet steps where they can put their feet very well. So all that should be put into consideration. Look at privacy and safety, like we had said, cultural practices, what kind of anocleasing do these people who have been displaced use? So all that information can always be gathered when you engage the community, involve this community as much as possible in implementation of your sanitation facilities. Okay, because when you do not involve them, then you are not going to know those things. And when you do not know those things, then there is a high likelihood that either they will shun away or they will not use your sanitation facility in that chronic phase, or they might use it but in a wrong way, and it will not last the time that you wanted it to last. Okay, so you need to involve them as much as possible. And even besides that, when you involve them, then they can be able to own this sanitation facility. They can be able to maintain it so that it runs smoothly. So we also need incorporating facilities of hand washing with soap and water. And like we had mentioned earlier, we need also make sure that we have materials for safe disposal of these menstrual equipment by the women and girls, and they shouldn't be stigmatized, or they shouldn't feel embarrassed because of their menstrual materials. So they should be able to, this sanitation facility or this pit latrine should be having disposal units for these females, so that they can put their menstrual or their menstrual towels in it. So the challenges that exist in these pit latrines are the fact that there can be rapid filling, uh, especially when you have a very big population. So in this case, the solution would be to educate users about alternating the pit use and constructing new pits. So you can put in place, of course, like I said earlier on, twin pit latrines, so that they use one at a go, one pit at a go. So when pit one is full, they can move to pit two, so that as they are using pit two, then you can empty pit one. Okay, but all this also is happening with the involvement of the community, with participation and making sure that you engage the community, because not all communities are very comfortable with emptying pits. Some communities are not comfortable with you taking away their excreta that you have emptied their pits. So you need to engage them. You need to make them aware that you are not taking their excreta maybe for your rituals. You are not taking them for something that is harmful, but you want to create space so that they can use this pit for a long time. Okay, then if the pit latrines are not well constructed, you can have groundwater contamination. So to solve this, you need to make sure that you use impermeable liners in your pits, so that the chance of groundwater contamination does not happen. But also, like I said, it is better or ideal to construct these pit latrines uphill and not downhill, so that the leaching of this uh, oh, I'm sorry, it is better for you to construct these pit latrines downhill instead of uphill, so that leaching is not leaching of this excreta, or the products of this excreta does not take place easily to the groundwater. So if it is possible, and the and the land uh, and the land is also favorable, then you should be able to construct these pit latrines downhill instead of uphill, so that this leaching is minimized. Then challenges of odor and fly control, whereby poor ventilation can cause these odors and attract flies. So you need to make sure that you have proper ventilation when you are constructing, and then screens on top of this vent pipe so that you can prevent these flies. Then we also have pits, those pits requiring regular maintenance. So we need to put in place maintenance schedules and also train and equip local staff who can do proper maintenance of these pits. So the other challenge is the fact that these poorly managed pit latrines can pollute soil and water sources, and this can harm the ecosystem. So to solve this, you need to encourage proper waste disposal. You need to make sure that the pit latrine is regularly maintained and there is safe disposal of the pit contents whenever the pit is full, so as to prevent this environmental damage that could arise from improper pit use. So pit latrines have been with us for a lot of time, and of course there are a lot of innovations here and there. So we have where the pit can be designed in a way that there is a double pit latrine, like I said earlier on, whereby you have two pits adjacent to each other, where you use one pit at a go. You shift from pit 1 to pit 2 when pit 1 is full, and you use pit 2. Then the contents of pit 1 can be uh, they can be emptied, and then as pit 2 is becoming full, you go back to pit 1. So this course will encourage that longer use of this pit latrine, so that you can have a sustainable sanitation solution. Then we have waste treatment, whereby these pit contents can be composted or they can be turned into biogas. We also have innovations in the area of putting in place sensors that can tell you about how that can help you monitor pit filling, and so that you can plan appropriately on whether to empty or shift to pit 2 in case you have the double pit system. Yeah, so from pit latrines and simple and and that pit system, we can go to septic tanks. And as you can realize, they can also only be implemented in the chronic phase or the stabilized phase of an emergency. They're a bit expensive, they require some bit of land, but they are also a measure that can be put in place in a stabilized form. So in this case, you have an underground chamber that receives, stores, and partially treats human waste and sewage. So the excreta, the wastewater from the kitchen and the bathroom all comes in this underground chamber that has been constructed in that place. So the purpose of this is to make sure that this human waste and the wastewater does not contaminate groundwater. And in this case, you have an inlet pipe like we saw in this picture. You have that inlet pipe that brings in this excreta and wastewater. Then here, the solids settle down and form what we call the sludge. But down here, there is also bacteria that is doing the decomposition of this excreta, and then the wastewater goes out through this outlet pipe. So, like we said, the inlet water brings in this wastewater and the excreta from the bathrooms and toilets. Then the septic tank has this bacteria for partial digestion of this excreta. Then we have the outlet pipe that is taking out the effluent for further treatment. So after this water has been taken out, then it goes to what we call a drain field, where it can undergo further uh, purification by other bacteria, and then it can now be allowed to flow and join the groundwater because it is deemed to be pure. Okay? So that is the component of this septic tank system. So how it functions is that it involves sedimentation, whereby the heavy solids settle down at the bottom of the sludge. After it has settled down, bacteria breaks it down, and then we have buoyant solids, all those light materials that form scum and remain on top. Then the effluent, or the water that goes to that drain field, is what we are calling the effluent, and it flows out for additional treatment by other bacteria in that drain field before it can go back to the groundwater. So when you are designing these septic tanks, you need to make sure that the tank size is based on the number of users or the expected waste volume. Also, make sure that what you are using, as much as possible, it should be local available materials so that you can cut costs of the financial resources. And then we also make sure that there is ventilation to aid that digestion process, but also accessibility, uh, so that maintenance and dislodging can take place. Because in these septic tanks, we always have problems of blockage of those systems. The pipes can be blocked, so this is why you need to construct them with those inspection chambers, the manholes, so that regular maintenance and dislodging can always take place. Okay, so as to have this in place for quite a good time. So proper maintenance and installation of the septic tanks involves tank placement. It involves making sure that there is that slope consideration so that the wastewater and the excreta moves under gravity as much as possible. And then, like we said, there should be regular dislodging to remove accumulated sludge and maintain functionality. Then we need to engage the community so that the users can be able to use this septic tank system very well. They do not need to. We do not need to have cases of people using things that cannot be properly flushed out to that septic tank system. The things that can block the system or the pipes. So that's why we need to engage the community so that they can be able to know how to properly use this septic tank system. So the benefits of this septic tank system is that it prevents disease spread. It is also a means of promoting dignity and privacy, because people feel dignified whenever they use this septic and flushing system. Then it also protects water sources because, as you have seen, the the excreta is treated, and even the wastewater is further treated in that drain field before it can gain access to the groundwater. So the challenge is here we expect cost limited space to put in place all this system. You need enough space. But if you have limited space, then it will be hard for you to implement the septic tank system. Also have ground conditions, because if you have unstable soil types and the water tables, you can have problems constructing this septic tank system. And in that case, if you are not careful, you might end up contaminating groundwater and other water sources. Then operation and maintenance is also always a challenge, because dislodging this system requires expertise which might not be available in some settings. So it is also a challenge. So apart from pit latrines and septic tank systems, we also have composting toilets, and in this case, they're designed in a way that separates urine from feces. And in this, you need to know that in this case, you you're converting human waste into nutrient-rich compost, which can be used in areas of agriculture. So this is why the urine is separated from feces, so that these excreta can be well composted and used in as compost, as nutrient-rich compost. So the benefits of composting toilets is that you have reduced water usage, because you do not now use flushing like the one in septic tank systems, but there is also prevention of pollution of these water sources, uh, since you are just going to use this waste to the since this excreta is just going to be used as compost. Then the fact that it converts waste into valuable compost is also a benefit, because it reduces the need now for chemical fertilizers. Here you're going to use the natural manure itself. That excreta, the human excreta, is turned into compost, and when you use it in your fields, when it is well treated, then you do not need chemical fertilizers. It also saves water and energy compared to those traditional flushing toilets of the septic tank system. And then we also recognize that we need lower infrastructure and maintenance costs, especially when you compare it to the traditional flushing system or the septic tank. Then we have reduced reliance on the sewage infrastructure, especially in remote, limited areas. We do not need this sewage infrastructure whereby you need to treat this wastewater, the excreta needs to join the sewerage system. So all that is not needed when you have composting toilets. So the way they work is the fact that, like I said earlier, you have urine and feces being separated so that composting can take place easily. Then there should be a provision for aeration to aid these aerobic bacteria to do this decomposition. And then you need to have in place this aerobic bacteria that will naturally decompose this excreta and break it down. Then over time, of course, this excreta will be turned into nutrient-rich compost. So we have different systems of compost, whereby we can have the batch system, where the waste or the excreta is collected in batches and composted in separate containers. So this is, of course, only suitable for places whereby you have few people, so there it can be collected in batches and composted in separate containers. Then in continuous system of composting, you have this waste being composted or harvested periodically. So you continually add this waste, and then after some time you can take it away. And it is also, this is ideal in settings where you have a lot of people, especially now in the humanitarian settings that we are talking about, if you have a lot of people, then you do not need to be uh, collecting this waste in batches, but you can use the continuous system and collect it periodically, like after a month, you take it for composting. Then we also have another method. The third method of composting can be vermicomposting, where you use worms to enhance this decomposting on top of these other bacteria, introducing worms so that this composting can be done faster. And when you use worms, you have even greater reduction of these pathogens in the excreta. So when you are implementing these composting toilets, or the ones which separate feces from urine, to optimize this composting, you need to think about ventilation, because this bacteria relies on this oxygen to do this decomposition. You need to regularly maintain this system. You need to keep on turning this excreta so as to aid this composting to take place. You need to educate the users to know how to use these composting systems. An example being the EcoSan toilets, whereby you have you have a compartment that takes away the urine and then the one which handles the feces. So the users need to be very conversant with how to use them so that you can get the best out of these composting toilets. Then we have safety, whereby you make sure that you prevent contamination and disease spread, especially when you are doing this maintenance, when you are doing this the taking of this compost. So it needs to be done in a way that prevents disease spread, but also location of your toilets away from water sources, so as to prevent pollution of groundwater. So we can realize from this case study that when you implement composting toilets, you are able to reduce water consumption as compared to the other traditional septic tank systems where you have to use water. And this also improves waste management, but also creates free manure. Okay, it creates very easy manure, especially when it is done very well. It creates that free manure, and you do not have to use chemical fertilizers which have their effects. So the challenge is in this case of the composting toilets is the fact that some people might not feel they might not feel very comfortable using them, or even they do not buy the idea of taking away their waste to be used as manure. Okay, so people might have there could be that problem of cultural acceptance. So to mitigate that, you need to involve them, you need to create awareness of how it is being done and its importance. Then there is also lack of understanding or resources for proper maintenance. So like I said, it is not commonly done in most of these communities, so there will always be lack of understanding on how to maintain and even use them. So that's why we need to properly train these people, these displaced people, so as to put it in place when they have really accepted and know how to use it. Then sometimes pathogen destruction is a problem. So sometimes due to maybe maintenance issues, not all the pathogens are destroyed. So as a solution, you need to monitor this the composting conditions, and make sure that there is sometimes more heat to what we are calling thermophilic composting, so as to aid or promote or quicken this composting. Then from composting toilets, we can also have power flush latrine systems, and these are basically systems in which you pour water after you've you, after after excretion. You can pour water and it goes away either to the septic tank or to to another pit. So in this case, this water is designed to not only take away the excreta but also maintain what we call a siphon or a seal, so as to prevent odors in this system of our flush latrine system. So it should be considered by for populations which are well conversant or use water for annual cleansing. So this power flush latrine system really relies on water availability. So in places where uh, there isn't enough water, the power flush system shouldn't be an option. Then the other thing is that it is liable to be blocked in cases where people use maize cobs or other solid materials like leaves for annual cleansing. So you need to make sure that before you install this power flush or implement this power flush latrine system, you know the characteristics of your community. If they cannot change or change to better annual cleansing systems, then you shouldn't use this power flush system. So from the beginning, we've been talking about uh, on-site sanitation systems, or we classified the sanitation systems in the humanitarian settings as those that can be implemented in the short time or the acute phase, where we had defecation fields and then trench latrines. Then we went on to look at those which can be implemented in the stabilized phase, where we looked at pit latrines, septic tanks. We also looked at these composting toilets and power flush latrines. So now we want to shift our discussion to talk about off-site sanitation systems. And in off-site sanitation systems, we are looking at the system whereby after collection after collection of this excreta, then you take it away to another place for treatment. Okay, so this one involves transporting of this wastewater to places where it can be treated. So in this place, we have the commonest, of course, being the sewage network and treatment plants. It is common in urban areas whereby, because of lack of space, you use a network of pipes which are always underground, and they take this wastewater and excreta to places where it can be treated fully. So here you want to consider factors like the location, cultural sensitivity, environmental impact of all this, then climate resilience. So these are all considerations in when you are designing off-site sanitation uh, facilities. Okay, you need to make sure that people are really going to use these facilities. Okay, because not all people are very comfortable using flushing toilets in these systems which require this off-site sanitation design. Not all people are conversant or are very comfortable with using, for example, these biodegradable bag systems or container based sanitation systems where you use mobile toilet and then you take away the excreta for treatment or disposal. So you need to make sure that you involve the community. You need to make sure that these off-site sanitation designs are very, very culturally sensitive. So the challenge is in this case the fact that infrastructure is always a challenge, limited resources to put in place these networks, Maintenance is also a challenge, especially in these settings of displaced people, or those emergency settings. It can be a challenge to maintain all this system that requires regular upkeep and proper waste disposal. Then there is also a challenge of changing the behavior of people from using those rudimentary methods of anal cleansing to those methods that are required to promote this offsite system. So if you are looking at a sewer system which requires you to use toilet papers, and people are not used to using these toilet papers or do not have them, you need to do a lot of behavior change communication so as to encourage proper use and maintenance of these offsite systems. Then funding and sustainability, due to the fact that they require a lot of infrastructure to put them in place, then you need funding so as to implement these offsite systems. But the benefits are clear, and the fact that they promote dignity and privacy. There is environmental protection since you minimize groundwater contamination. Here, the waste is taken through pipes to to centralized treatment places. So groundwater contamination is not always very possible. Then disease prevention is also a big benefit of these offsite sanitation systems, but also the fact that it can be flexible to adapt to varying population sizes, since you do not have to collect it in one place or in one confinement, but it is taken away, the excreta is taken away to another place for treatment and disposal. So there is that element of scalability. So that is all about the off-site sanitation systems. So from on-site and off-site, now we can look at the hybrid sanitation systems, which involve both the on-site and then the off-site. So in this case, you also want to look at systems like the decentralized systems, whereby you can collect and treat the wastewater in the septic tank, and but you treat it partially. Then after that, it can join these sewer systems and be treated further in these decentralized or centralized systems, which are somewhere else. So in that kind of system, you can think of it as a hybrid sanitation system. Then we also have the fact that community-led sanitation, community-led total sanitation is a community-based approach to sanitation that promotes simple, affordable sanitation technologies. So in this case, like I said at the beginning of this session, you involve the community, you trigger them to think about uh, the sanitation technologies that can really be applicable in their setting. You do not enforce something onto them, but they are the ones to be triggered to think about what is best for them. So that is what we call community-led total sanitation. So you put them into a situation where they realize that what they have been doing is not good, and they need to do something, and they put in place, or they are triggered to think about the technologies that can be put in place to solve those problems that exist in their sanitation practices. So when you are doing all this, whether it is on site, whether it is off site, whether it is in the acute phase, whether it is in the stabilized phase, you need to do it with ethical considerations at the back of your mind. Human dignity should be considered, and in this case, you need to look at things like privacy. Okay, you need to look at things like You need to look at things like gender sensitivity. People should not feel ashamed of being in menstruation. Okay, that's why you need to provide facilities that handle that. Okay, then there should be equity, fair distribution of these sanitation services for all the affected populations, the people with disabilities, the elderly, the children. Everyone should be able to access and use these sanitation facilities very easily. Then you should involve the community from the word go. Make sure that they are the ones who tell you what they want, and then you can see how you can put it in place. Okay, so when you involve the community, as we shall see, they are able to own these sanitation facilities. So when they own, they can maintain. Then it will also be culturally sensitive when you involve the community, but also it promotes behavior change when you involve the community. So the technical principles in all these sanitation systems are that the sanitation systems should be able to contain the human excreta so as to prevent pollution of the environment, and you are looking at the soil, the water, and all the other components of the environment. So this can be done through putting in place systems like the pit latrine, the septic tanks, and sewer systems. Then uh, there should also be provision for treatment of this human excreta after it has been contained, and this is through aerobic and anaerobic composting. But after it has been treated, you should also think about how you dispose of this human excreta, and this can be done through uh, methods like incineration or ocean disposal. So it should be done in a way that is environmentally responsible and not causing problems or pollution to the environment. So in all these excreta exposal sanitation technologies, in humanitarian situations, we have innovations and approaches. Okay, we are talking about low cost options whereby the number of those low cost sanitation technologies that have come up, and they can be implemented in settings whereby there isn't a lot of financial resources. So look at things like composting toilets, urine diversion systems, pit latrines can be a very good low cost option. Then ecological sanitation. In this case, we want to make sure that the excreta is a resource rather than the waste. Think of approaches that turn this excreta into biogas, into compost that can be used as manure, biogas as a source of energy, and other valuable products. Then we have reusing this excreta or the wastewater, which can be used if treated very well for irrigation. The compost itself can be used as manure in agriculture and other applications. So we need to be innovative in all this. Okay, even in those humanitarian settings, we need to make sure that we be innovative, use low cost options, use options that are ecologically sound, and those that promote reuse of this excreta that has been collected. So in future, we are looking at treatment that does not use electricity, but does not use hydroelectricity, but uses renewable energy like solar powered treatment. Then we can also have remote monitoring of systems status, so that it can always inform us on whether we need maintenance or not in time. Then resource recovery, using this excreta to 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 give us biogas or use it for nutrients and that can be used in agriculture. So all these are future trends and innovations which might be in place in some settings but might not be in place in our settings or in humanitarian settings. So as public health officials, we are encouraged to think in that direction. So in all this, we realize that excreta uh, needs to be handled in a very environmentally friendly way. Should be handled in a way that promotes dignity amongst the people who are displaced. Okay, it also needs to be handled in a way that does protect the water and soil. So we need to think about those sanitation facilities that do promote all that. So as public health officials, we are encouraged from this video